Howdy again, everybody. This is Doc with Therofan, and of course, well, the big news that just broke across today was Medina Spirit coming back positive for betamethasone in his post-race sample after the Kentucky Derby, and of course, it has raised a lot of questions about exactly what the drug is, what it does, how they're testing for it, where we go from here, and of course, at Therofan, we are about providing the best education possible for all of you fans out there. And of course, I am primarily a small animal veterinarian, so for us, betamethasone is used more for sometimes itchy animals, allergy things like that. But in order to get the best answers, we've gone to one of the real experts, and we have with us Dr. Kathryn Papp, who has extensive experience in the equine veterinary world, and especially the racetrack world as well. So we are gonna jump right in and ask her a bunch of questions that hopefully will be able to give you guys a good basic understanding of what the drug is, and how it's tested and kind of where we're going to go from here in this whole saga. So thank you for joining us, Dr. Papp.
Nice to be here.
And so we're going to start right off with the basic question that everybody wants to know: what exactly is betamethasone?
Betamethasone is a class of pharmaceuticals that is known as a glucocorticoid, and it is a potent anti-inflammatory. It's actually defined as a potent glucocorticoid steroid with anti-inflammatory and immunosuppressive properties.
All right. So a lot of people may not know that exact steroid. A lot of people are more familiar with the steroid dexamethasone, which may be even prescribed for humans as well as other pets. Is this kind of the same drug as betamethasone, or are they different?
They have similarities and differences. Dexamethasone is often used either orally or injectably into the horse's system for, let's say, hives or itchiness, as you were describing with small animals. And it is a quick-acting, potent steroid, corticosteroid that will take away inflammation. Like I said, if you got stung by a bee or if your horse was having a reaction to something, that may be used to get the inflammation under control. Betamethasone is actually only labeled for intra-articular, so in the joint use in the horse, as a way to treat inflammation that is from synovitis, osteoarthritis, pain and inflammation within a joint.
Okay, so yep, you kind of answered with the next question that most people are going to have, which is kind of how do we administer it in horses and what is it used for? So really kind of injecting it into the joint is the only thing that we would really be using this drug for in horses. It's probably rarely injected into other areas, correct?
Correct. It's actually only FDA approved to be injected into the joints of horses. It used to be, now we have Betavet, which is an FDA animal approved, equine approved drug. There used to be Celestone, which is the human product, but it is the most commonly way it is used in horses by far, whether in racing or any other of the equine industries.
All right. So, obviously we're injecting it into the joints to try to help a little bit with the inflammation that's going on and things. How long would it last, as far as the effect of the drug lasts for the horse, if it's administered as normally done?
Well, that's very variable, and as most people may know, people have their shoulders and their knees or their hips injected by their doctors, often with a similar corticosteroid, all of which are kind of derivatives of the naturally occurring cortisone in our bodies, and they know how that hurts when you first get your painful knee injected that has fluid on it, but then in 5 days they feel great. And most of the time people with injuries in their joints or inflammation, they say that those injections can last up to a year. Whereas the horses, what we've seen in research is that the lameness, if there is such lameness or inflammation that's going on in the joint, based on the studies, will have almost immediate, within a few days, response to the injection, and then can last up to months.
Okay. Are there any kind of negative side effects that we would worry about in using it in horses?
Yes, there are. In fact, as in the definition, it specifically says that it's a potent corticosteroid, which is an anti-inflammatory, but also an immune suppressive. That's what differentiates between your non-steroidal anti-inflammatories, such as what humans take would be ibuprofen or Aleve, and what horses would get Bute or Banamine. Those are non-steroidals. This is steroidal, and that works from the immune system, and therefore it has effects of immune suppression. It also increases insulin resistance. It can decrease bone density. It can increase the risk of EIPH, or bleeding from the lungs, and also increases the risk of infection because it's an immune suppressant. So any injection we give into the joint already has a risk just by the injection process itself. However, injecting an immune suppressive makes it even more risky.
Mm-hmm. And I know, of course, a lot of people that are fans out there or casually follow the sport are going to have this question. So would it be considered kind of a performance-enhancing drug, or would it be able to enhance a horse's performance if it was given?
That certainly depends on how it was given, when it was given, and for what reasons. Let's say for a horse that I know in training have never raced before, or may have raced, and all of a sudden I notice that one joint is thicker than the other, or has fluid, or seems a little uncomfortable to stand on or manipulate. I may take an x-ray, an ultrasound, a CT, MRI, anything of that joint to find out what's going on, make sure there's no bone damage, and if whatever it is going on is significantly limited to the joint space, then the best thing to do, like anyone who's ever jammed their fingers, to get the bad fluid out and stop the inflammatory process as soon as possible, and that is a good medical reason for using it. However, if a horse is injured and has arthritis, which is what actually Betavet is legally made for, it's to treat the pain and inflammation associated with arthritis. So a lot of these horses that are racing, they're not naturally doing that in the wild. So we do see arthritis in young horses and horses that do this job, and there is this very strong pain-relieving, anti-inflammatory effect when injected into the joints, so which lasts a very long time. So if a horse is painful, maybe favoring one leg, and you do inject that joint or that area, it certainly can be a performance enhancer. Limping versus not limping, I would think somebody who is not limping would run faster.
Yeah. All right. And then finally, we talk about everybody is familiar with thinking kind of any kind of medication or substance that might be given to a horse would be a quote-unquote illegal substance. But really, betamethasone is more in the class of what we consider a therapeutic substance that, can be used in racing, or in training, I should say, not necessarily in racing, but in training for horses. So it's not illegal to give it to the horse at any point in its life when it's training, correct?
I believe that there are rules. It differs from state to state on when horses can receive intra-articular injections of corticosteroids. Most states now have a policy of no joint injections at all with any substance, at least 14 days before a race. Some, where there's reporting during training, if they receive joint injections, will go on to the vet's list and have a stand down on exercise or training. But absolutely, it can be used therapeutically. The idea, and I believe there was a white paper from the AAEP, the American Association of Equine Practitioners, a few years ago, stating that we do these things to treat a condition and then monitor for response in order to determine whether that was the right thing to do. And if the response is not, it's not to be given in order to make the horse race better. It's meant to be used to treat a certain condition and for no other reason. Okay.
So it would be different than, say, like we've heard of cases of like snake venom and stuff like that being given to horses that, which are really just totally never to be used and are considered true illegal, medications. This would be different from that.
Correct. Yes, it would be.
All right. So I hope that answers at least some questions just about betamethasone in general. We're going to take a quick break, and then when we come back, we're actually going to talk about the specific case with Medina Spirit and kind of what's going to go on next and what's involved in the testing. So hang tight, we'll be right back. Welcome back, everybody. This is Doc with Therofan, and we are incredibly pleased to be joined by Dr. Kathryn Papp, who is a very well-renowned equine veterinarian, especially in the racing world and racing circles. And so we went to her as the expert as we're talking about the big breaking news with Medina Spirit, obviously coming back with that positive for betamethasone. And in the first part, we obviously talked all about what betamethasone was. Now we're going to deal a little bit more with this particular specific case. So you touched upon it kind of just at the end of the first segment. There is kind of almost a nationally recognized now withdrawal time before horses can race after receiving any kind of intra-articular injection, including betamethasone. So what is that kind of time frame that they look at, and what is the reason that they've kind of selected that time frame?
There was actually a study done by the RMTC, which is the Racing Medication and Testing Consortium, a few years back, and it was specifically done to investigate the pharmacokinetics and pharmacodynamics of betamethasone being given into the joints of horses and how long it lasts in their system, how long it has an effect, what effect it does have, and how long it can be detected in their blood, their urine, and also in their joint fluid. So there are some studies out there, and based on those studies, they've shown that an articular injection of 9 milligrams into one joint will clear the blood and urine of all those horses within 7 days, often much sooner.
Okay, and so, saying that, then is there a reason that the drug might be detectable a little bit longer in either blood or urine, potentially just in the way it's administered, or anything that could potentially affect that timeline?
Sure, there's always multiple factors, such as the absorption and metabolism of that particular individual. There's other medications that could possibly interact and prolong the metabolism of the medication. Let's say their horse has a liver problem. They might not metabolize as fast as another horse. There may be some drug that makes it metabolize faster. Also, injecting joints, it depends on horses which joint is affected and being injected in the first place. And some of those joints are quite small and difficult to access. And some of the studies show in the smaller hock joints that only about 45% of veterinarians injecting them are actually getting all of the medication into the intended area. So some of that could be leaking into under the skin area, just like you would be giving insulin to a dog or a cat, and that is much more slowly metabolized and left in the system versus if it's going strictly into the joint.
Mm-hmm. So and obviously all horses that win a race, and usually sometimes the second and third place horse, as well as maybe special horses selected by the stewards, all go to what is known as the test barn to have samples taken for post-race testing. What's the most common samples that normally they would look for evidence of betamethasone in?
Most often, samples of blood and urine are the main substances taken from the horse that's produced. And we heard in the press conference with Bob Baffert saying that he was going to be submitting samples of his own for the horse, hair samples for DNA testing, as well as to look to see if his claim of the horse has never ever received betamethasone before. Sometimes we can detect drugs that were given a while ago or even sometimes months previously in hair samples. So is that kind of the case with betamethasone? Is it possible to detect betamethasone that may have been administered a long time ago in a hair sample where it would not be detectable in blood or urine? Well, that's an interesting question because the research is not fully there yet. Hair testing samples and the medications that can be detected in such are now just being elucidated a little bit further. So I'm not sure I can definitively answer that. Some research in humans does indicate that betamethasone will be able to show up in hair samples, but at what point in time after receiving it would that show up is questionable in itself, and whether or not it'd be in the hair follicle, if it would diffuse down lower, if it grew at the same rate. Synovial fluid, they've shown if you actually sample the fluid from the joint of the horse, they find concentrations of betamethasone much longer there than if it was just in the blood or the urine. It'll be completely gone, undetectable by any of these picogram levels, but it'll still be detectable in the fluid of the joint. So there's a few things in the wings where they can detect it, even theoretically a liver biopsy or some such other method I've seen done for necropsies and so on, but it's still up in the air, and I'm not sure how scientifically based it would be at this point.
Okay. And then finally, you hear anybody who's seen the press conference or hears a lot about what goes on in a lot of these positive cases that are first noted, the trainer is notified, and then they have the right to request what is known as a split sample to be sent off to kind of confirm that the test truly is positive. So what exactly is a split sample, and how does that whole process work?
Well, when the horse goes after the race to the testing barn, where they're observed and their blood and urine are collected by hired veterinarians, they pull a certain amount of vials and collect a certain amount of urine, label it, and make it specific to that horse. And then it's set aside through a chain of custody release. And the first part of it is split, literally. So a part of that total volume will be sent out to be tested for prohibited substances. And if that sample does show up to have something it shouldn't in it, there is another remaining amount of volume of the same exact sample in case the laboratory messes up, and that has been known to happen. So the trainer has the ability to use the remainder of that sample to send to one of a few laboratories of their choice to see if indeed that they find the same positive, negative amount in those substances.
So it's kind of both a secondary check, but also a confirmation per se of what the first lab found on their sample testing.
Correct.
All right, and that kind of in this whole saga, which has just started, is where we are right now. Right now, we are waiting on the split sample results to come back for Medina Spirit. It's probably going to be at least a couple of days, if not a week or more, before we do get those results. So until then, Therafan is going to be watching this whole thing very, very closely. We'll be bringing you updates as they come through, but we are incredibly appreciative of Dr. Papp for joining us this evening to go over all of this and to kind of give you the expert advice and facts on this stuff, and that's what we're about at Therafan. We want to make sure that everybody has all of the proper facts out there so they can kind of form opinions for themselves. So once again, thank you for joining us this evening, and as I said, Therafan will be keeping well on top of this and seeing exactly where everything goes, and as for everything and anything that is involved in racing for the fan and for those interested in becoming more involved in the sport, there's only one place that you really want to turn, and that is right here at Therafan.